Hi, I'm Natalie Thompson. I'm a certified nurse midwife at Hurley Medical Center. And either you're walking around right now in early labor or maybe you're at home, but regardless, I am excited for you. Congratulations that you've made it this far into your pregnancy. You might be feeling a wider range of emotions in terms of excited, nervous, anxious, but I feel like a lot of new moms who are doing this for the first time are certainly a little bit nervous, and that's very normal. Labor can take a long time, especially if it's your first time doing so. So you might feel some contractions and think, oh, this is so exciting, and it is, but chances are you probably have some time, so you don't need to run out the door, pack your bags, and alert the media in terms of your family. So active labor by definition is contractions every 2 to 3 minutes. So that's when we know that things are really ramping up. But before that, you might have contractions every 20 minutes, every 15 minutes. So when those begin, we want you to start timing them. Ideally, the point of reference that we like to give you is that we like to hear from you when your contractions get to every 5 minutes, lasting for 1 minute times 2 hours. So you can call it the 5-1-2, okay? Every 5 minutes, lasting for 1 minute times 2 hours. However, you're gonna know your body best. So if you feel like these are increasing in intensity or you feel like you need a little bit of help, please call us. We are always available for you to help you make that decision. It can be very normal to have irregular, painful, consistent contractions that are not meeting that 5-1-2 rule. So it might be that for an hour you have contractions every 20 minutes and they're painful, take your breath away, but we're just not getting the frequency quite yet. That can go on for even a couple of days before your body truly goes into active labor. It's kind of a mental game. You want to stay as positive and as energetic as you can. Rest in between contractions and know that it's a marathon, not a sprint, especially for the first-time mom. Some people have a lot of their labor in their back. If that is the case, probably position changes will be the best help for you. So getting off of your back and trying to rotate the baby. Sometimes when you have persistent back pain, it can be based on where the baby's position is. So you might hear the term sunny side up. And that can be very normal in the early labor process. So if you can help your body by doing different positions, that would be best. So including hands and knees, a hot pack, and massage are probably your best bet for labor back pain. This might start very early into your pregnancy. You might be somebody who's kind of always had uncomfortable contractions. So contractions are greater than a menstrual period cramp. Usually when it's more active labor and dilating your cervix, they're usually painful, take your breath away, and you can't ignore them. So it might be possible that you have something called Braxton Hicks contractions. Please don't think of these as your fake contractions. They are uterine irritability that maybe you'll have for a few weeks. But regardless, if you're feeling that you're having some tightness to your belly, which I have a little demonstration I'll show you in a little bit, those are very normal in pregnancy. However, they are not normal if you are less than 37 weeks. So if you are what we call preterm, which is less than 37 weeks, we do want you to call your provider if you're having regular, consistent cramping contractions. So active labor is 2 parts. It's regular rhythmic contractions. You could do the 5-1-2. In addition to cervical dilation. So sometimes you'll have cervical dilation. You might be checked in the office and you're like, wow, I'm starting at 2 centimeters, which is amazing, but then potentially you would still have an induction and be overdue. That's very normal. Or maybe you'll have regular consistent contractions, but then you need your body just to kind of catch up with the cervical dilation. So it is kind of a process that we're happy to walk you through. So next I'm going to show you kind of my own little uterus that I brought for you. It is a balloon with a ping pong ball, so you can see here that there is basically the ping pong ball, spoiler alert, is your baby, okay? So if you can picture, this is your beautiful uterus. So what you can see here first is that your cervix has some length to it. So if you're a visual person, you kind of need to think outside of the box for me. But if you tip it upside down, it's sort of like a wine bottle. So in that it has a long neck and not a lot of opening. When we get to pushing, we basically want this to be at a mason jar, meaning that there's not a lot of length to it and there's more dilation to it, which is the opening of your cervix. So if you could think about your uterus, this is kind of the home for your baby. Your baby is in your uterus, and then your cervix is basically the doorway to the home of the baby. So when we do cervical exams, we're actually touching this part of your uterus, which is the home to your baby. So when we were talking about Braxton Hicks contractions, those contractions kind of come here from the middle and they wrap around. So that's why you feel that tightening. But you can see here, it's not really doing all that much to your cervix, though it might be irritating it and softening it before we get to active labor. Labor contractions kind of squeeze from the top, and you can kind of see here, and it might take me a few pushes here and a few contractions. So once we have regular rhythmic contractions, and you can see that they're kind of having some length to them in terms of longer than a minute, which contractions might be a minute upwards to 2 minutes would still be within normal. So as we move along, we can kind of see here that your cervix is starting to thin. So that is what we call effacement. To push and have a baby, we need this to be paper thin, meaning that it would be 100% effaced. In the beginning of your labor, you might be called thick, long, high. That is very normal start for starting your cervical exam. So we're just gonna keep our regular rhythmic contractions. Now, at this point, you're probably getting a little bit tired because maybe you've been at this for a few hours. Maybe you've woken up in the middle of the night and you've been up all day at home. So what do you do if you are maybe a little bit dilated, a little bit effaced, but you're still at home, you feel like you are able to manage and cope with your contractions? Let's pause on our labor course and talk about that. As long as you feel safe to be at home, you can stay at home as long as possible, basically, especially if it's your first time having a baby. The things that you can do at home is, number one, a great resource for you that you can look at that has plenty of videos is called Spinning Babies. So this is going to be a variety of exercises, including side lying release, forward pose, that you and both of your support person or partner can help do at home. And this is going to help kind of rotate your baby down. So when you're having those contractions that are kind of squeezing from the top, you also want to think about where the relation is of the baby in your pelvis and make sure that the baby is fully engaged in your pelvis. And a way that you can do that is through different positions, including hands and knees. You want to think about your pelvis being sort of like a bowl, and as the baby's head comes down, you want to rotate. The baby might have to kind of make some turns and twists to make sure the baby is coming down. So that's a great resource that gives you wonderful videos in addition to this video. Other things that you can do at home is hydrate, change up your position, get in the shower, take a bath. You can also do hot packs. A little bit of sugar here and there to give you a little bit of energy. I think that it's a really good idea, especially as you're feeling short of breath in these contractions or taking your breath away, you're feeling like you can't get much of relief. It's nice to set time frames for yourself. So if you say, for 15 minutes, I am going to stand and rock and hold on to my labor support person and maybe turn on a little music. Then in 15 more minutes, I'm going to get into the shower for 30 minutes and be on the birthing ball then after that for another 15 minutes. Usually if you set realistic goals and tell yourself that you could do anything for 15 minutes, that kind of helps breaks it up and makes you feel like you have a point to get to. I want to take a second and pause and talk to the support people who will be with you. It can sometimes be very overwhelming to see your loved one in pain, and you might go through periods of feeling very helpless. So things that you can do is, number one, be cheerleading. Number two, not get at all hurt by the fact that the laboring person might say, I don't want you to talk during a contraction, or I do want you to talk during a contraction. And then with the next contraction, they say the complete opposite. Or maybe massage helps for some period of time, and then it gets to a point where the laboring person says, nope, this doesn't feel okay. So you have to just kind of roll with the punches in terms of what contraction to contraction your laboring person needs in that moment. Support people, partners, please try to stay positive. Try to distract them as best that you can. So maybe it's music, maybe it's watching a favorite TV show in the background for sound. Maybe it's low breathing and focusing on that. Maybe it's even visualization of their favorite place. I know that it can be kind of scary for all parties to be in labor and to be uncomfortable for many hours on end, but you have to just remind yourself that you're going to have a baby soon, and the baby will be very cute, and eventually you won't remember this labor pain as much. So let's say that you are sleeping and it's 3 a.m. and you wake up and you feel like your bag of water has broken. You have a big gush and you've saturated your bed, which maybe you're sitting there thinking, oh my gosh, what if that does happen? But it can be very common that that is the case where you break your bag of water without contractions. Usually after your bag of water breaks, whether it's done in the hospital or at home, it can make your contractions feel very intense. So the best thing to do is to call your provider. Take note of the color of the fluid. If it's clear, then that is good. If it is brown or green, we certainly would want to hear about that. You'll also, throughout the entire labor process, want to be in tune with fetal movement, which we talk a lot about in the office, but we still want that to be true. You should always feel your baby move, even when you're having labor contraction pain, although it can be sometimes difficult to monitor that as well as your contractions. If ever there is a doubt or you're not sure if you felt your baby move to its normal pattern, we want you to call in your labor process. The other signs and symptoms that we would want to hear about is vaginal bleeding. Bloody show can be normal, which is kind of where you have some bloody discharge as you go to the bathroom. But if you're having vaginal bleeding that is starting to mimic a period, we want you to call your provider. In terms of triage, once you get to triage, if you're one of our patients who are walking around right now, you've maybe already experienced this, but the way that it works is you will go through the emergency room, they will take you to OB triage, you'll meet one of our team members who will evaluate your labor process at that time. If you think you've broken your bag of water, then we will do a speculum exam and test the fluid to make sure that it's your bag of water versus other bodily fluids that are very normal at this point in your pregnancy. Additionally, if you feel like you're having regular contractions, we might do one of those cervical exams that we talked about to kind of see where your dilation is. It's possible that we might have you walk around at the hospital for some time. We might recommend that you go home for a period of time, or it might be time to be admitted and have a baby. All right, let's go back to our balloon that is laboring. So at this point, maybe now we're at the hospital and we're still having these regular rhythmic contractions. And maybe they're getting every 2 to 3 minutes. Active labor by definition is 6 centimeters. However, labor can be different for every person, the way that is perceived, the way that it's felt, and also how long it can take. Now, if you're a second-time mom or third-time mom or more, forget everything I just said. If you are having regular rhythmic contractions and you feel like you are laboring and you need some help, it is good to call your provider sooner rather than later, maybe even sooner than you get to the 5-1-2 rule. So now we see that our cervix has completely thinned out and now we're starting to get dilation. In addition, if you can kind of picture your pelvis here too, you notice that you can see the baby, our ping pong ball, a little bit lower in your pelvis. So now we are at the point of pushing. And soon, we will have a baby. We're feeling all that pressure, we're pushing really strong. And then we had our baby! Congratulations, we had a baby together.